My name is Dr. Jakub Sikora. I'm a spine surgeon at the Salt Lake Orthopaedic Clinic. So I grew up in Michigan. I went to undergraduate at Michigan State University. I went to medical school at Wayne State University. I did my residency at the University of California, San Diego. And then from there, I went to Texas Back Institute in Dallas for my fellowship. I went into orthopedics because I wanted to save lifestyles, getting people to do what they want to do, what they need to do, and getting them back to being active is my main goal in life. I specialize in everything from the neck down to the lower back, anything operative and non-operative as well. Most spine things are non-operative, so we have to be well versed in terms of injections and most importantly coming up with a good diagnosis. The most common issues I see are typically back pain, leg pain, and really just some weakness or numbness or even shooting pains. I know that's a mouthful, but with the spine it's all very complex, so the most important thing is getting an accurate diagnosis. Patients should come see me when they're ready to see a doctor. I think a lot of times there are certain aches and pains that patients often can live with, but ultimately if it gets to a point where you're saying, I can't do this anymore, I think it's a great idea to see a doctor. My specialty is disc replacements. I've done many. I think anytime someone's been told that they need a fusion, I think it's reasonable to also see if there are any other options available, such as disc replacements or even simple decompressions. I think what differentiates me is my ability to relate to people. I grew up in Michigan in some not nice neighborhoods. Been fortunate enough to live in really nice neighborhoods. Went to school in downtown Detroit. My grandparents and distant family live in Poland. I was born in Austria. I've traveled to over 30 countries. I did my residency in San Diego, so I know what it's like to live in the ocean. I know what it's like to live in the mountains. I lived in Dallas for a little, so I know what it's like to live surrounded by nothing. And just in terms of life experiences, young, old, I'm able to relate to people in different phases of their life. My patient care philosophy is patient education. Everything I do centers around making sure the patient understands what's going on with their body, what a procedure entails, what the outcomes look like, and kind of what their future holds. What makes our clinic special is the people inside of it. I'm fellowship trained in spine, specifically in disc replacements. There are people in our group that are trained in shoulder, elbow, hand, sports surgeries, as well as joint replacements. So even if your problem isn't solved by me, I can directly point you to someone who's specialty trained in that problem. My favorite part about my job is my patients. It's so fun being able to talk to them, just being able to really develop a really good relationship in a relatively short amount of time, and being able to ask and learn about so many different things. I mean, the stories that you hear from 20-year-olds is way different than someone who's in their 70s, so I love that part. If you have any issues with your back or spine or neck, feel free to call our clinic and set up an appointment. Even if you have questions about your diagnosis, even if you've been told that you need to have some sort of other surgery, we're happy to talk.